Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
Hello. Glad to be back in the closet, literally here. So I'm kind of tired today, and I'll tell you why. And so this just, I'm going to tell my version of what I'm thinking. And then Bethany, you obviously have a smarter, more extensive, way of connecting all of this together. But one thing that I thought would be really helpful to talk about today, again, my practice, it's really just me. I've got some friends who kind of help with call every now and then. And knock on wood, we really don't get called in very, very often. Most things I can triage over the phone. It might be a swollen face or it might be trauma, send me a photo. What does it look like, right? But it's been a while, like a year, or months. It's been a while since I've had to go into the office. So last night I am in bed. So today's Sunday. So yesterday it was Saturday, and it's 11:40, and I'm barely
PM.
making it awake. PM. And I was watching an episode of something on TV, so I'm like barely head bobbing, going, okay, I just got to finish this episode. I want to know what happens at the end of this, and then I'm off to sleep. It's all I could do to keep my eyes open. And then my phone rings. And I look at it, and my husband was out, so I wondered if it was him needing a ride or whatever he needed, right? So, and then my kids were at my mom's, so I thought maybe it's one of the kids calling me and saying hi or something they forgot to tell me before I left. So I look at my phone, and it looks like it's from a company. And I'm like, really? Spam at like 11:40 on a Saturday night? Like, okay, I mean, I get a lot of spam, but not at that time. So I kind of just thought it was odd, went back to watching my show, and then I heard my little phone go off that I had a message. And I'm like, okay, they're leaving messages now. Are you kidding me? Well, it turns out it was a patient. So I don't know what their phone was linked to or why. And it took me back to days of residency, because as a resident, you'd get paged at night because kids would have trauma or something go on. They'd go to the emergency room. Dental always falls to the bottom of the priority list. So every other kid would get triaged that's in the emergency room first, and then they'd get to dental. So if the kid was out at the park at 4, maybe by like 9 o'clock, their turn's coming up to be seen.
Yeah.
And then they paged the dental residents. And so it was very funny how this, I almost thought I was sleeping. I was like, is this a dream? Because my eyes were bobbing all over the place. Thank goodness I didn't have anything to drink, right? And so it was a dad who had talked about how they were at a birthday party and the kid fell and avulsed number 8 and the kid's 9. And how they kind of rinsed it off, wrapped it in their paper towel. Yeah. Yes, I know we're all cringing right now, because as I did, and went off to urgent care where they sat for 2 to 3 hours, then finally got looked at, and they said, don't do anything. Oh, by the way, maybe you should put that in milk. Here's you a cup of milk, and call your dentist. And so the dad calls me at 11:40 when they're leaving urgent care. And, in my mind, my heart just wanting to vomit, just beating for this kid, going, okay, well, you are 9 years old, tooth number 8. And, technically speaking, the prognosis is,
now, especially.
Bye. Yeah, it's done. And anyway, long story short, we did end up going to the office. So I was at my office at 12:15 last night, and I got home at 3 a.m. It's just like being in residency, right? And we did end up replanting the tooth and splinting it. Please don't bombard me with why I shouldn't have done that or why I should have done that. That's not the scope of this conversation right now. The point was that there I am at the office at 1 a.m. And it made me go, oh gosh, well, now what do I do? Like, who am I calling to go up there with me? Because we've always talked about not being alone in the office, whether you're a male or a female provider, like either way, right? So it's always better to have somebody, but I'm not going to call my assistant at midnight. She's got little kids. And yes, you heard me say that, right? My assistant. Remember the one that I had a few before, but like
your singular assistant.
My singular assistant. That's where we are now. And I know I've kind of alluded to some challenges with staffing over these last few podcasts. And so just firming, that's my assistant that I did not call. And instead I called my associate and woke him up and said, hey, like, this is what I'm thinking of doing. Can you look up the trauma guidelines just to make sure I'm not wrong on this? And what are we doing? So we kind of put a plan together and I said, okay, meet me at the office. So we have Tweedledee and Tweedledum trying to figure out how we're going to find what we need. And literally I'm going, okay, I know how to turn the compressor on. I'm pretty sure I know how to get Dexys up. I think I know where we keep our Nomad. I mean, what a gong show. I'm trying to think of a nice word here. What a gong show. What a circus. Like literal Tweedledee and Tweedledum. I'm like, is this how you turn the water on here? Is there a water bottle in the unit? And if I'm useless, associate's even more useless. So anyway, so while I'm trying to set up, because I got there before, the associate and patient did, and I'm trying to find stuff and I'm trying to go, okay, what are we needing? Okay, if I can splint the tooth, what am I going to need? And even something as little as, where is my splinting materials? Like we used to have a emergency kit stuff. Can't find it. Cannot find it, y'all. Like ridiculous. Can't find it. And so then I started going, well, why can I not find this? Like, well, then I stopped and I went, well, I wonder if we don't use it very often at all, especially out of office hours.
Yeah.
And so I can't remember the last time we had to. So I get, some of y'all listening might be going, what? We do it all the time. But I don't. And so I was like, I can't find our ortho wire or our fish line or whatever it is. We had a whole kit of stuff that we need to use. And I started thinking, well, was it like assistant before last who had been here for 5 years? And then, so maybe like the newer assistants as they're cleaning out and going, well, what is this? We don't need this. Chuck it out. Like, I don't know, because I looked every place I could think of. I take that back. I did not go into the storage closet that's in the bathroom and climb up there. That's like the one place. Maybe that's where it is. I don't know, but that's not where it should be, right? So, I mean, I am top to bottom. I'm on the step stool. I'm looking top. I'm checking all the drawers. I'm checking everything. So in a way, it was a good kind of Easter egg hunt where I'm finding other things. I'm like, why is this in here? And so and it's like, am I really dreaming right now? What is going on? Anywho, found substitutes. Let's just say we got it done. But my thought was, first of all, if I was not in town, it's kind of concerning me right now because I'm not in town a lot this summer.
Right.
And so if my associate does have to come back up, we discovered yesterday he's got a key to the building, but he doesn't have an alarm code.
Oh,
and usually
no.
I do both together, but he's never come in after hours. So we set his alarm code because as we're leaving, he's like, hey, I've got the key, but if I came in by myself, I'm like, we never set your alarm code. Okay, do you know how to turn the compressor on? Do you know how to turn nitrous on?
Yeah.
Do you know how to get the sensor going? Do you know how to... And then even for me. So I ended up assisting him. And the only reason I assisted where he actually was the one replanting and I was the one running around because I'm the one who knew more than he did about where to find stuff and what we have in the office. But things like, do you have a wire cutter? Do you have a surgical suction? Do you have all of this? It's like, yeah, we do, but it would have taken him far longer to find. Anyway, point of all of this is, especially now with turnover and being shorthanded, there are so many things that I have forgotten how to do in my practice. I used to do all of it. I used to do my own billing, post my own claims, and do all my own everything. The one thing that made me happy is I was like, I should probably get a consent form ready. Yeah. So I go up and luckily I opened the drawer and they were right where they should be. So it's like, yay, good job, front desk person. Like, you guys got this. Like, it looks good. So it was good for both to say, like, I've got these things here. Okay, so here's another issue we had. I get the sensor plugged in, but the computer won't read it or recognize it. So then I have to hop to another computer. We've got a couple of sensors. Well, one of them is tagged. This one only works in these 2 rooms.
Wow.
Why?
Yeah.
And how come the other ones aren't tagged? Because those should work in any room. but they're not working at that room. None of them are. So where's the one that works in that room? And I thought we kept all of this in this drawer, but that's not where it is. So I thought we had this, like just silly stuff like that. Like I thought we had this and I thought we had that, but we don't have it anymore because we're a busy practice and there's a lot of turnover. And frankly, there are so many headaches right now that I cannot keep up with. Where is the XYZ? And so all of that to say, it was a good lesson to be learned. And I'm not as familiar with my own practice inner workings as I thought I was.
Yeah.
And I think a lot of that is, you know, we change things and I've just farmed it out to the team to do. And several of those people are there, but then several of those people are not.
Yeah.
And so it's kind of like, where are we now? And honestly, I was embarrassed. I was embarrassed to my associate going, well, this is what I got. And he's like, do you have this? Do you have this? I'm like, And so it was dumb. It was really dumb, right? Like your system, it should be easy that anybody should be able to come in and take it and do it. And it was a wake up call for me to go, okay, well, that's not what we had.
Right.
And thank goodness it was me that was there and nobody else, because I don't think anybody else would have been able to troubleshoot it.
Right.
So again, this morning, I got paged again this morning. And so it was yet another kid that got, you know, it's great weather. Everybody's outside. So for Pito, we got really busy with trauma. So kid got hit in the face with a baseball and luxated tooth number 9, and he's 6 years old and he can't bite into occlusion. So I was like, okay, well, I'll meet you at the office. And so luckily, you know, I warned the parents, I said, you're just stuck with me. Like, I don't have an assistant right now. So bear with me. You're going to see us fumbling around because usually somebody else does this. And luckily our patients, you know, were very kind and chuckled with me. But the one today, I was like, you know, I was just here at 3 a.m. So I kind of remember how this goes. That's why I was able to set up so quick today. She was so sweet. She's like, oh my gosh. I was like, yeah, it's been a doozy. And so anyway, so today I was able to go, okay, I know this sensor works in this room because I did it last
a few hours ago.
Less than 24 hours ago, about 5 hours ago. I was back here doing all this again. So I was able to quickly move through it this morning.
Yeah.
But again, it was just another reminder this morning going, okay, like what all do I not remember how to do? Yeah. And sadly, we're at that point where there is so much turnover and, you know, it's just endless beating. It's an endless beating, but it is what it is.
Yeah.
And
it's a hard time to be reliant on a staff that you really don't know. Are they going to be there, you know? And I think you've been blessed with some good team members along the way that you've been able to turn over a lot of that, and you've been focused on other things. And now, you know, kind of a literal wake up call in the middle of the night where you're like, hey, did you like that pun?
Yeah, I did.
That you ultimately just you couldn't run it without them. And I think had this occurred, you know, 2 years ago or 3 years ago now, you would have not thought twice about it. Like, oh, it is what it is. It's an emergency in the middle of the night. My staff is normally there. There's really no need to know it. But I think the reason that it's more of a wake-up call now is because of the ever-evolving employee market where, you know, it's even the people that you most rely on, you can't rely on them. And so I think that realization of like, oh gosh, I need to know about my practice more than I ever have before.
Mm-hmm. And it's kind of defeating. And on the other hand, it's kind of like, okay,
this is
my baby. I kind of forgot about a lot of parts of my baby. Let me go back and reinvestigate and rebond.
Yeah.
My pun, rebond with the office.
We're all about puns today.
Yes. So I think it's good with all of that. I think also, and I've always said this to anybody I know, like associates of mine that I know are going to start a practice or do something, or even not, even when you're just in the office, you know, so and so calls in sick, and so had this, and you're shorthanded, and if you don't know how to, you know, do basics of sterilization, or you're trusting your team that they know what they're doing to maintain infection control procedures. And I mean, I think there's a ton of things that we just don't want to deal with. We have so much to deal with, and it's so easy to say, oh no, they've got it. And I'm going to challenge you and put one more thing on your plate and go, I don't know that they've got it.
Yeah.
I don't know that they do. And so either you could keep sticking your head in the sandbox and wait for a problem. And I know we all do that. But it's also, you know, just, I mean, how many times now alone have I been the one to kind of jump into sterile and keep us going, because it stops. If I don't have instruments, I can't see these patients. If I can't get a room flipped over, I can't see these patients.
Right.
And so somebody's got to do it. And it's really frustrating that it's us who's got to do it. But I think that's where we are now. Yeah. At least that's where I found myself the last couple of days. So if somebody has something for me to say, hey, no, don't do that, do this. Well, please alert me to where I'm missing.
Well, I mean, to me, the best plan B is going to always be the one singular person that we know is going to be there, which is usually
me,
the practice owner.
Yeah.
Yeah. And so I think, we've lived in a time where that plan B didn't even need to be considered, but we're not in that time anymore. And I don't think we will be for some time. So no, I think we need to have a plan B. Or maybe it's considered Plan Z now. I don't know, because there's still plenty of other options before it gets to the practice owner. But still, the buck may end up stopping with the practice owner at some point.
And I'll say, honestly, as much as I don't like it, on the other hand, it's very empowering. It was very empowering last night for me to go, you know what? Honestly, if it was just like me and my associate, and we assist each other, you know what I mean? Like in this day and age, it's so hard to find anything. And it's like, my world doesn't start and end with you.
Yeah.
And I think that's where, for me, it has been so frightening going, I can't lose this person, or I can't do that. One thing I know I've alluded to those last couple of podcasts, and I'll just say it here now with the drama. And again, I'm still not ready to talk about it, but I'll just say it. My manager, who's helped me start the practice, has been with me for 11 and a half years. And I've always been petrified of when she's going to leave. Mm-hmm. And she's leaving.
Yeah.
And, again, are there things that I could have gone and said, oh, I should have done this, I should have done that? Honestly, in this case, absolutely not.
Yeah.
It is 1,000% her. I don't think she's making a smart... We didn't have a fight. Nothing's wrong. We're not upset with each other. I think she has always been, because she started with me when she was young 20s. And, in that time has had a lot of life stuff happen to her. And I think she's always questioned and gone, is this my ceiling, or is this the only place? So, I think she's going out and testing the waters. Finally, she's in a situation to where she can do that.
Yeah.
Financially, she's at a place where she's...
can take some of those risks.
Yeah. And so I really do wish her well. But it has been jarring to go, there went a person I relied on heavily.
Yeah.
And, we've seen the signs that she's going to be leaving multiple times over the years. And you saw it, and you've been helping me.
We've pivoted so many times to retain her, and it worked.
It worked, but also you've been going, okay, if it didn't work, who is our backup person, and what is our plan should she walk tomorrow? And so you were kind of real key in the background to shift this to this, or train that person with that, or take this on. So honestly, it's a big hit emotionally.
Yeah.
But practically, we're going to be fine.
Yeah. We've been preparing for a long time.
You've been at the forefront of that. And so I think we are at a point now where we're going, okay, well, now we need to have another plan B should the next top dog head out. Mm-hmm. But so in that situation, it was very empowering last night for me to go, okay, well, the person I leaned most on is gone.
Yeah.
And who else is going to be leaving? We just don't know, right? We've been talking too. I know we mentioned it before, like Amazon. How I cannot compete with Amazon. So some of our sharp ones may head off and do that for a little bit. Yeah. So it was really empowering last night for me to go, I could get the splint done on this kid against all odds with just myself and my associate. And I mean, he was useful to it because I needed another set of hands, but literally I came into the setup, I started the notes, I took the x-rays, we got it done. As he was giving post-op, I cleaned up, I turned everything off, and it was very empowering for me to go, I can do this.
Yeah.
So if I'm left assistantless, God, that would suck, but I know I can do it. So back to that feel and vibe of, I don't want to be held by my balls. Like, I don't want to, and it was very empowering for me to go, I can do this.
Yes.
So.
Yeah. Well, and to even have a moment that you might not have anticipated that exposed something where you're like, okay, I figured this out, the middle of the night, I figured this out, I can make it happen. But even maybe causing that to ask the question, okay, well, what else do I need to possibly expose myself to that I need to figure out so that I could, swim in the moment that I have to.
That's exactly this podcast. That's why I was like, we should talk about this, because I want to make sure that everybody's being as proactive as you can. And I know I am right there with everybody else, with entrenched in the drama and entrenched in all of it. So to put one more thing on our plates, to go, okay, well, now start proactively going. Can you go find your own, like, if you have to assist yourself on a, if your assistant's not there to come in and make your temporary for you, or to do your, whatever it is that people help you with, could you do it?
Yeah.
And if the answer to that is yes, great.
Yep. Well, and to view it from an empowering thing. It's not a defeating thing. It is let me equip myself to be able to run in a way that maybe isn't comfortable for me, but a way that I can run if need be. And so I think from that angle, it is very empowering, and hopefully provides a sense of freedom that in this type of employee market, we might just need to kind of reflect on that, that creates a confidence that we can do this. In the worst case scenario situation, the whole team leaves, right? And I've got maybe one person left with me. Could we do it? Yeah. We can figure it out in that moment. And I think that's a good way to look at it, where it's empowering. It's not overwhelming or one other thing to add to the plate, but it's something to breed confidence.
Absolutely. And I think I've been saying that, but saying it like with the chip on my shoulder. Well, fine, everybody else leave. Like, all I really need is this. And but I've been saying it, and I think now it was like, put your money where your mouth is. Is that right? And I did.
Yeah.
And I can do it. Yeah. And I will do it.
Exactly.
So, it was very freeing and empowering.
Yeah. So then when you were talking about this, when you came over, I was thinking about how this applies to so many other areas of the practice. So obviously the clinical side of it, which even as I was listening to you talk again, I mean, how helpful would it be just every so often to be the first one to the office, and you're setting up, you're turning things on. You're actually getting, everything running in the office. If nothing else, just to remind yourself, do I know how to do this? Do I know where where these instruments are? And so I think even just that alone would be helpful. Obviously, there's not a patient in the chair, so it's not kind of real life, so to speak. But I think that would be challenging for some doctors who've gotten to a point where by the time they walk in the door, everything is, as it should be, ready to go. And so that may be a good little takeaway just from your clinical example. Can you think of anything else from the clinical side that would be?
I mean, I'll be honest, even right now, I don't remember how to use the sterilizer anymore. I don't know how to fill the blue stuff, that gross blue, the ultrasonic, the disgusting thing. I don't know how to drain it anymore, and I don't remember how to fill it. There's so many things. It's endless. It's endless, the things I could go back and teach myself on or remember in the office. But yeah, I think that's a great exercise to come in and see, like, can I get all the lights on? Or for my associate, like, you're going to be on call for me a lot this summer. Can you get yourself going here? Mm-hmm. Even today. So I didn't bug him this morning when I got paged for the baseball kid, but I did try calling my assistant. No answer.
Yeah.
And so I was like, okay, it's me, myself, and I. So it was just me up there. And luckily this was not a re-splinting. It was a, we needed to see if I needed to splint or do something like that. But in the end it was fine. But,
thankfully you had the trial run in the middle of the night, right?
Yep.
So preparedness, I mean, on your own, that shows the value of preparedness. You had that event in the middle of the night, and then the very next morning you're being called in again. Nobody's available at that point. You are on your own, but because you had the trial run the night before, you were it wasn't as jarring to you. It was like, I got this.
Yeah. In fact, my associate, because I had posted something on our office thread that was like, hey guys, like, I made some joke about being called in, but I was like, hey, for front desk team, we've got to bill these and send these claims and follow up with the patient and get this one referred to endo and whatever we have to do. Like, so there are steps to be done when you come in tomorrow. Don't feel blindsided or don't feel confused. Like, where did this come from? Yeah, right. I was in here this weekend. And same for the clinical team, where they're like, I thought we cleaned all these instruments. Yeah, but I used some, and, so that they could know what had happened. They're in the loop. And so separately, my associate messages me and he's like, you went back today? Why didn't you call me? And I was like, because I knew I could manage this one myself. Yeah. Because I did know I could manage it myself because I just did it.
Exactly.
So,
yeah. It shows you the value of being prepared. So yeah, I think a good clinical takeaway is, get with your assistants, have them show you sterilization process so that you know how to run every aspect of that if needed. And that is more a reality today than it's ever been before. You may very well have to step in and run sterilization on your own if you don't have an assistant, or knowing where supplies are to be able to find at least the generalized location of, if I need XYZ material, I'm going to go to this area. And then turning everything on, setting everything up, getting the X-ray sensor attached and finding the Nomad and all of that. Like, to me, doing that even on a quarterly basis, like the first day of every quarter is going to be when I go in and I set up my practice for the day. And that's a nice little surprise for the team. And then that's also keeping me on my toes and making sure that I'm equipped.
I mean, something as simple as the Nomad.
Yeah.
I was like, how do I use this thing again? I mean, the last time I used it was when I was in the OR. Well, I haven't been in the OR in over 2 years.
Yeah.
So I was like, oh gosh. And I figured it out, but it was still a moment of, this should have been easier.
Yeah.
Because I forgot that I didn't know how to use the Nomad.
Yeah.
So dumb. But it's like you just forget things, right?
Yeah.
So it was a good reality check.
Yes. Okay, so clinical, and then I thought, of course, my mind goes immediately to the business side of things. So again, I feel like you've got safety net people in your office that we've talked about in other podcasts.
I had safety net people.
Yeah, you've got one less now. You've got a good, strong clinical person on your team, a hygienist, that manages so much more than just hygiene, but she is an excellent extra set of hands and a mind and all of that in the back. So she's able to oversee a lot of clinical things. And then you've got your AR person who's remote, but she's constantly running numbers. Anytime you ask her for any kind of numbers, she can kind of produce those for you pretty quickly. She inadvertently audits a lot of things, like mistakes that may be made from a billing standpoint, that she brings to our attention. And then you've had your manager, who was in a lot of ways auditing. I mean, she was watching what people were doing. She would listen to phone calls. She would watch text message exchanges and kind of keep us apprised of what was going on in the practice. And so we're losing the manager now. Still have the AR person, still have the clinical person. But to me, it always brings me back to the importance of the practice owner knowing their practice. Like, I keep thinking about what's the title for this going to be? And it's like, know thy practice. Like, just know it. Know clinically. Like, know everything that you need to know if you have to step in that scenario, or if you're having to run without an assistant or a hygienist or something like that. Can you do that? And then also from the same thing from a business standpoint. Okay, we're talking about losing your manager. How are we going to essentially audit the inner workings of the practice now? Does that mean that now staff members are bringing items of report to you, that they are, things that they're accountable for, they're having to bring to you now? So, for example, one of the things is your manager was, they would submit the supply order, and then she would actually go through and order it. And that was a way of auditing. Is what they put on the supply order, I'm ordering it. So now, is that something that goes to you? Is that something that you at least see the order before somebody places that order? Also, I kind of envision, what if your AR person was gone? Okay, now what's your oversight?
Bite your tongue. Bite your tongue. What was that where you were saying about, even you were literally sitting right there, and you said, oh, just every week I'm going into these practices, and somebody else where you're like, oh no, please not you, leave. And that very week is when my manager is leaving.
It happened that exact week. I'm sorry.
Yeah. So don't cast
Speak
that in
into
my
existence.
AR person leaving. Gosh. I'm leaving now. This podcast is over.
Meeting adjourned. Bethany will finish this on her own. Dr. Kuba quit.
I stormed off. Yeah.
But yeah, I mean, do you know how to pull the reports? And again, thankfully, I would be a backup person to that, so I can pull the same report she's pulling. I can pull all those reports. But I think practice owners need to know, how do I access that information? And am I looking at that frequently enough that I know how to even interpret that? Your
A CPA is another great backup support to that, where yes, he may not be able to actually pull the report in Dentrix, but he would be able to decipher it should you need his set of eyes on that. And so I think just, again, building either plan B, C, D in, which I think is wise these days, which is what we did with your office manager when we knew there was a chance she would leave years ago. We have been planning for this. So our strategy was, well, first of all, let's tweak her job description this way, but let's also, and this is when we pulled in the hygienist, we also had an assistant that was a part of it for a while, into this leadership team model, and they became backup. So now, yes, your manager's leaving. We've been preparing for that. Your hygienist is incredibly indoctrinated and incorporated into all that she was doing. In a lot of ways, she can do most of what she was doing. And so now you and I were just sitting here talking about, okay, now we're back to one, and that's a risk these days. So how do we, dispense that responsibility out to somebody else? So that may be the strategy, but I still feel like even if we've got backup C, backup D, backup E, at some point, the buck stops with the doctor. And so how do we get the doctor, fully equipped to be able to take that role on if and when he or she needs to? So I would say a couple things to be clinically, I think starting the practice, start the practice one day, get it all set up, get it ready to go, have your assistants show you sterilization so that you know that category well. I mean, almost a dry run through. Let's just pretend you had a middle of the night call, and it's almost like we do all this emergency training, medical emergency training and HIPAA training and OSHA training and all that. Okay, train yourself to run on your own. Yeah. What would you need to do if somebody called you in the middle of the night and you had to show up? Could you do it? So that kind of dry run would be nice clinically. And then I would say from a practice standpoint, get to know each individual team member's role. What all are they responsible for? Have them produce a list and say, okay, put every responsibility on your list. And then makes me think of an assistant that we asked her to do this. But take that list. Okay, here's Sally's list. This is what all she does. Let me see. Could I do this? Number one, she, runs the day sheet at the end of every day. Do I know how to do that? Nope. Don't know how to do that. Okay, I'm highlighting that. That's something I got to learn. Okay, Sally collects payment on every single patient when they leave. Okay, do I know how to process a payment? Nope. All right, I'm going to learn how to process a payment. And you go through that job list and you just figure out what are the things that I think I could probably figure out or I already know. And then what are the things that I would have to learn if I didn't know it already. So I think just that alone, get everybody's job description and figure out what you know and what you don't know.
Because again, I think most of us knew it at some point. I know I knew all of this at some point, and now there's a fraction of what I know.
Mm-hmm. Yeah. And it's just a testament to the changing times where we always had a plethora of people where if our plan B went away, we could replace plan B with a new plan B person, or we could move on to our next staff member because we have them in a plenty. And now that is shifting. And I do think the mindset has to become more self-reliance than everything else. And I know that can feel like a pressure, but I love the mindset that you have of it, which is it's actually a freedom. It's exhilarating to know that I could, if I need to, run this practice, or I could step in, my one front desk person is out and I've got nobody to replace her. Could I walk the patient out after I'm done treating them and check them out and dismiss them? What is the strategy if my one front desk person is not in the office on that day? And so I do think equipping yourself, knowing every aspect of the practice is a critical takeaway.
Know thy practice.
Know that it's going to be the title. It has to be. Any other thoughts that you have on this?
No, I'm just a little overwhelmed at all, but I've got to go study again. But, hopefully it's like riding that bike, I think, because that's how it was last night. Like, once I kind of got in the zone and figured it out.
That confidence of, I do know this.
Yeah.
Yeah. And again, I think if a listener is early on in the practice, I think it's a good note to self, stay involved. No matter how big the practice gets, that you're staying involved and you're still understanding and keeping tabs on every aspect of the practice. And then I think for, doctors like you that have been in their practice for a while and they've got a good team, it's time to pretend like you don't and to go back and know thy practice once again. So, all right. Well, thanks for sharing about your Midnight Madness.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.